Good afternoon, everyone. My name is Cristobal, student physical therapy assistant. Today we're going to be working with the Chattanooga device for interferential current, describing what it is, indications that we would use, precautions, contraindications, the whole gist of why we use interferential device. So to get started, we all talk about indications, precautions, contraindications as to why we would use it and why not. So indication is mainly edema reduction and pain reduction. It can be used for both. Today we're going to be using it for pain reduction because I have some shoulder pain going on. And in addition, we're also going to be talking about precautions and contraindications. So precaution would be cancer, any cardiac disease, impaired cognition and sensations, and then any open areas of for wound care situations. However, there's contraindications where we would not use it, such as if a patient has pacemakers, we do not want to place it over the carotid artery, over their eyes, over their gonads. If they have deep vein thrombosis, and in addition, if there are a woman, we do not want to place it on them if they are pregnant, specifically in the lower abdomen region. So we'll go ahead and get started with the area. To clarify, I don't have any of those contraindications and precautions, but I do have that indication of pain reduction around the shoulder. So we'll go ahead and get started with turning on the device. With the Chattanooga device, go ahead and get the outlet, plug that into an outlet. This button in the back, we'll go ahead and press that turn on. Beep indicates that it is turning on and getting set up. Now there is our selections. Obviously before we've done ultrasound, now we're choosing electrotherapy. We test that tab. With electrotherapy, once it is loaded, we get multiple different selections. Today we're going to be addressing interferential, so we'll click this first button. And right away we see a screen with preset settings. We're going to want to edit it based on the parameters we want to use for different physiological responses. Our sweep is on. Turning on sweep, this is just going to be varying between frequencies or staying at one specific frequency for this beat low, beat high. Sweep is currently on, so this will go between beat low, beat high, between 80 to 150 hertz for frequency delivery. If we have sweep turned off, it will be at a beat fixed where it will constantly deliver at 100 hertz. In this situation, we'll go ahead with sweep on because we're going to be doing opiate release. With opiate release, we're going to be adjusting the beat low frequency, beat high frequency, and carrier frequency, and then we can adjust the vector scan if necessary. For opiate release, we're going to be aiming for a beat low number of 2 hertz and then beat high frequency of 10 hertz. Carrier frequency will be at 2500 hertz, and we'll go ahead and change that. Right now, what we're seeing is the physiological parameters for, sorry about that, gate control theory, where we have 80 hertz, 150 hertz, and 4000 hertz. This will go ahead and address gate control theory, which is pretty much sending stronger signals to go ahead and block pain receptors. We change that to 5000 hertz. This goes into nerve blocking for physiological response. And now we're at 2500 hertz for carrier frequency, where carrier frequency will go ahead and address opiate release. Endogenous opiate release, this is more of a long-term effect, whereas these two, the 4000 and the 5000, are during treatment. So we'll go with the 2500 hertz for opiate release, which will address it for a bit more of a long-term, up to 24 to 48 hours. We'll go ahead and adjust the beat low frequency to match the parameters to address opiate release. So beat low will be changed to 2 hertz. We'll go ahead and press this button, and we'll go ahead and change this number all the way down. So tap to this button all the way down, and we're just going to put 1 up to 2 hertz. Now our beat high number, we're going to check this button, and we're going to go ahead and change that all the way just down to 10 hertz. 10 hertz. Vector scan can be off to go ahead and centralize the pain, and I'll explain what that centralization is going on. Or we can have it manually, where we adjust the positioning of treatment areas. 40 to go ahead and disperse the treatment area a bit wider than normal, and then vector scan where the treatment area is much more wide and dispersed. constant voltage or constant current, the CC/CV. This is pretty much a unit of measurement. We'll go ahead with constant voltage for our unit of measurement, as we're going to be able to turn this dial up into having different intensity levels to where I'll be able to start feeling the intensity. Intensity is going to be varying between different patients. So this is something that you'll want to adjust and see feedback with the patient to see if they are responding with the tingling sensation or muscle twitch sensations. In here we're aiming for tingling sensations. I'll get to that a bit more. Treatment time for interferential, we can go between anything between 20 to 30 minutes of treatment time, depending if we're on opiate release, gate control theory, or nerve block. All of them can be 20 to 30 minutes. And that is the setup of the interferential. However, let's go ahead with setting up how the patient would be. Today we're just going to be setting it up on myself. So to set it up on a patient, and for today's example, it's going to be myself. We're going to expose the area down to skin for the treatment area. I want to address my shoulder pain today, so I'm going to go ahead and remove my scrub top. I have a tank top underneath to just be able to be properly draped, covered up, but my shoulder will be nice and exposed for me to place the electric pads on there. So I'll have my scrub off. So now that I have my scrub top off, I'll go ahead and get an alcohol prep pad. The alcohol prep pad is important to go ahead and clear up the area of any dirt, debris, lotion, sweat, whatever, to get the area clean for the electro pads that we're going to go ahead and placing on the skin. This allows so it doesn't interfere with the electric currents being sent towards the region, along with it being able to stick easier. So I'm just going to wipe it down. Nice and white. We're going to be addressing the shoulder, so we're going to place this in a square pattern, and we want to centralize the region of pain. Right now, I'm having my pain area be around the center of my deltoid muscle. So I'll go ahead and place it just around to where the point of the cross section is going to be in the center. Okay. So the middle of the deltoid is going to be my treatment area. Have it lined up. And having it aligned it is and isn't. It is important. We'll have that lined up. The wider we go, the more treatment area, but we're going to go ahead and centralize it just down to that center area of the deltoid. Perfect. And now we have all the electro pads placed down. We'll go ahead and have that be crossing in between here, where this central region is the treatment area. We'll go ahead and plug in the wires into the machine. These are the two wires. The important part is that these wires will cross between channels. Make sure it's in frame. Pull this little thing off. Plug it into the first channel, number 1. Perfect. And the important part is crossing. So with crossing, let me go ahead and address the hardest one for me. We'll plug it in. It will be right here, the very bottom right pad. Right pad is put on, and then this red one will go directly across, diagonally across for treatment. And this is the first wire, channel 1. Channel 1, nice and across. This first wire. Now we got the. See, bro? Second wire, going for the second channel. Plug it in there for the second channel. This one is going across this way. This is important for IFC. And anytime its channels will always cross. That's the channel goes there. And the last channel. Get it. If I can get it. It's kind of hard when it's yourself, obviously. The easier when it's the patient helping them set it up. But all the pads are there. And again, once again, these channels cross. This wire is channel 1 and it's going here and here. This wire is channel 2 and it's going here and here. So it goes a line, makes this X pattern. That cross section area is where treatment area is going to be at. Once again, we're targeting the middle deltoid for pain reduction site. And with the settings that I originally showed earlier, we're aiming for endogenous opiate release, or our beat low is 2 hertz, beat high is 10 hertz, carrier frequency is going to be at 2500 hertz, and vector scan, I'll go ahead and change that into being 100 hertz, so, or 100%, so I can go ahead and address more of a bigger area for treatment. Treatment time, I'll go ahead and leave that at 20 minutes. And now y'all will just watch me for those 20 minutes while I explain the rest of the details. I'll go ahead and press start. Set at least one intensity, and then I'll go ahead and start. Now, let's see what it says. Now my timer is going, and I'm just going to adjust this frequency to go ahead and until I start feeling a tingling sensation. Make sure I'm in frame. Yeah, so we're going to go for that tingling sensation. And the intensity can vary between different patients. Some might be higher than ourselves as patients, some might be lower. It's all dependent on patient feeling. Right there, I just felt a muscle twitch, so I'm going to go ahead and just turn it down because we're aiming for a tingling sensation, not a twitching going on. So right now, the frequencies are going between 2 hertz and 10 hertz. That's just varying between how much delivery and output is going to go on in the treatment area. Still having some twitching going on, so let's go ahead and adjust that down until I only feel tingling sensations. And let's make sure the pads are connected. I'm just not feeling anything, and this is why having the dial to go ahead and switch around to where we feel different intensities and different feelings is important. Now, this is a stationary treatment, and that means it's not functional. That patient can go ahead and just relax, sit in a chair, and wait for the treatment to go on. We give them a bell, just in case they need a signal to the physical therapist assistant or one of the staff to get their attention if we step away. Right now, we're just going to go ahead and be stationary, not have to do any functional movements, unlike other treatments like NMES and Russian treatment for electrical stimulation. I'm just constantly addressing, making sure that the pads are connected. I gotta turn the intensity slightly up because I'm not feeling a tingling sensation anymore. Let's go ahead and get that up. Now it's just twitching with muscles. So we'll go ahead and is really where it's playing around and trying to find that intensity of comfort. Now with treatment time, this is 20 minutes to 30 minutes right around 20-minute treatment time. However, post effects, especially for these specific parameters for endogenous opiate release, I should be able to feel effects of opiate release for up to 24 to 48 hours. Post-treatment time, where I'll have pain reduction going on in my shoulder for that amount of time. It's unlike the other settings of gait control and nerve block, where those are only during the treatment time to reduce pain. Those have benefits in their own. For me, I'm aiming for a long-term benefit to go ahead and reduce pain once I'm outside of the treatment. So that's why I'm aiming for this when it comes to endogenous opiate release. To discuss more about gait control theory, like I said, would be beat low, beat high. Beat low would be 80 hertz, beat high would be 150 hertz, and the carrier frequency would be 4,000 hertz. That's to address sending more stronger electrical signals towards the brain to block off those pain receptors. And then with the nerve block, it would be similar beat low, beat high of 80 hertz, 150 hertz, and 5,000 hertz for the carrier frequency, which would go ahead and block off the nerve signaling to that area. Once again, intensity needs to be slightly increased throughout the treatment time, depending on the patient, what they are feeling. There was a feeling of there's on the feeling of twitching, and now I'm feeling that tingling sensation. So you can see excess muscle twitching in there, mainly I'm just aiming for a what's called tingling sensation. I'm feeling the tingling sensation in the lower end, however on the higher end, that's when I'm getting some muscle contractions or hurts for that, so it's again. And it is hard to find that balance, obviously just trying for that dial to go around. You can have maybe some little bits of muscle contraction, but the primary focus is we're trying to get that tingling sensation going on with the electric pads. This is a form of continuous treatment because it's constantly running between that 2 hertz to 10 hertz frequency. There's no on-off time. There's no ramp setting where it's slightly a ramp, slightly not in its own sense, where it isn't a ramp almost. Technically there is no ramp setting, but because of the 2 hertz and 10 hertz, that frequency adjusting, it's slightly on its own ramp, but technically not the ramp setting like specific devices like the TENS units or NES units that we have. Right now we have 12 minutes left of treatment time. very dependent on the patient's response. To describe my tingling sensation, it's almost like tickles or taps, but the muscles aren't moving. It's just very, very light taps going on for my tingling sensation. Like someone as if they're like rubbing something rough on the skin, like a stone. I'd say like it's a skipping stone on the skin. That's my best way of describing my tingling sensation going on. It might be different on different patient. Once again, it varies on patient to patient, but feeling and intensity levels. But primarily, tingling sensation, not too much of the muscular contraction or muscle twitch when it comes to endogenous opioid release. Getting a little bit of excess muscle twitching going on, so let's turn that down. For this example, we'll go ahead and switch the vector scan to be off, so rather than being more by dispersed, treatment area will be just centralized into the cross section of the pads. Tingling sensation going on. There's some muscle twitch going on, so we want to turn that on. It's not too much. You feel a slight little twitch going on, or just light rub on the skin. So that's what I can describe my tingling sensation. Again, patient by patient, it varies what that tingling sensation is going on. Advisable to tell the patient they can adjust intensity here and there if needed throughout treatment, just to go ahead and get more of a feeling of that tingling sensation that they're aiming for. startup time for the machine. 20 minutes of treatment, and then it goes ahead and gives us parameters that we're able to record as necessary when we got recorded for our soap notes. For our amplitude or intensity, we're at 6.2 volts. Frequency was 210 for beat low, beat high, and then carrier frequency is at 2500 because we're aiming for that interferential opiate release using interferential treatment. So now that that is complete, we can go ahead and stop treatment. Go home, turn on the device. Now we can safely unplug the connecting pads from our electropads, connecting wires. To any shoulder flexion, shoulder extension going on, with some shoulder abduction going on. I do already feel an immediate sense of relief where there's not too much shooting pain, like a stabbing sharp pain. Feels, I wouldn't say normal, but feels definitely in pain reduction where I can go ahead and move my arm around without too much pain compared to prior to the treatment. Interferential current treatment in a nutshell.